So, hi everybody. HS
Hi.
Connect is here today with Attune, also known as Help for HS, and Dr. Egeland and Dr. Biscoe are here with us today, and we are going to talk about naturopathic and functional medicine. And what I would like to start with you guys is, can you tell me the difference? And is there a difference between the two?
Yes, that is a great question. So, we are naturopathic doctors, and I'll spend just a little bit of time
Yes.
first explaining what that is. So, naturopathic medicine is a distinct profession. A naturopathic doctor attends a 4-year post baccalaureate medical program. So, the scope of our training is very similar to that of a medical doctor. And in fact, the first 2 years of our medical education are practically identical. We dissect cadavers. We learn all of the anatomy and physiology, histology, pathology, all of those core basic sciences. And then in the following 2 years, we study the clinical sciences. So we study all aspects of physical exam and physical diagnosis. We study the systems medicine, cardiology, gastroenterology, gynecology, dermatology, all of those. And then we also learn diagnostic imaging. We're also trained in pharmacology. So I think a lot of people don't recognize that a naturopathic doctor is not only trained to prescribe and manage medications when appropriate, but to also understand all of the important interactions that can happen between, nutrients, botanicals or herbs and medication. So we understand all aspects of that. After graduation, and after completing a clinical internship, we sit for 2 sets of rigorous, well, actually, there's a board exam halfway through, and then a second set of boards that we have to pass in order to obtain a license or registration. And the reason I talk about the license, the registration, and the board exams is because there are traditional naturopaths that haven't necessarily attended a 4-year hands-on accredited medical school. There are various online degrees or certifications that a person could complete. And generally, these are focused on basic wellness recommendations, basic lifestyle principles. They might learn some nutrition and botanical medicine, but they're not trained to the full scope of a physician in the capacity that they can diagnose, treat, and refer. So there's an important distinction there. The other thing I want to talk about is functional medicine. And we think of functional medicine as kind of a modern spin on naturopathic philosophy. And I really want to emphasize the point that naturopathic medicine is very old. Our philosophies are very old and traditional and tried and true, whereas functional medicine is a newer approach to healthcare. It's not a degree. It's not something that's regulated. It's something that any person or any practitioner can do training in to learn a more holistic approach. And where I see functional medicine really shining, and why we have kind of based our clinic around functional medicine, is really taking advantage of the cutting edge lab tests that help us really get down to the nitty gritty of these subtle imbalances that can be going on in a person's body. So we do a lot of testing for toxic environmental exposures, mitochondrial dysfunction, all of these specialty testings that can help us really dive into what's going on. But jumping back to the naturopathic foundation, I also want to make very clear that naturopathic doctors think differently. Our goal is not to treat sickness. Our goal is to ask why a person is sick, because we believe that the body is self-correcting, self-healing, that our base is health. And when there are these disturbances in our core function and our core physiology, in our emotions and our spirit, all of that, that's when disease or symptoms manifest. So we're looking at the symptoms to find out what is this telling us, right? Instead of saying, I have asthma, what can I take for it? We're asking, why do you have asthma? What systems are engaged? What's going on in your life? How's your digestion? What things in your environment are you being exposed to? So our job is to identify these imbalances, identify these obstacles that are getting in the way of that natural healing process and remove them, and then support the body's natural healing efforts and enhance that. So the tools that we use work with what the body already wants to do. In the conventional approach, the treatments are based on suppressing symptoms. So we're not really getting to the root. We feel better, but we have silenced the body's message and we haven't really fixed anything. So that's the core difference. I hope that explains it.
It explains very well, and I like that you touch on the prescription aspect, because I'm kind of a victim to that, to be honest with you. I have several illnesses on top of HS, and I was just talking to my husband the other day. Every time I'm able to remove a prescription, whether it because I'm doing something more on the natural side or whatnot, these prescriptions, I'm on 40 different kinds, and they cause symptoms.
Right.
So now you don't know what you're dealing with anymore.
Right.
So I am all about what you just said.
Yeah, that's great. Yeah.
And
Naturopathic doctors want to build health rather than treat sickness,
right.
because when you create health, then disease goes away.
No, totally understand. And this I keep looking down, guys, because these are where my questions are. I'm
Sure,
not
no
even.
worries.
So I think because you just said what you said, I'm going to skip down to a question. Can you help us, civilians, know the difference? I have been down so many paths, holistic, functional medicine. I feel I've dealt with some pretty good people, but I have also heard so many times people getting taken advantage of. How do we know the difference between a legitimate functional medicine, holistic, I'm sorry, naturopathic,
Yes.
as opposed to people getting taken advantage of? Is there signs we can look
Yes.
for?
Yes. And I'm so sorry that that has happened. And some of our own patients have been taken advantage of or deceived before finding us. So when it comes to naturopathic medicine, the most important thing to look for is where that person attended school. And I'm happy to actually share a link with you, Denise, for your viewers, so that they can understand how to vet the truly accredited schools. Because a lot of people don't realize that someone can say, I graduated from an accredited school, but who accredited that program? So here in the United States, we have something called the Council on Naturopathic Medical Education. And that is the only oversight body that is endorsed by the US Secretary of Education to give the thumbs up for quality and standards for naturopathic medical education. So there are, I think, 7 or 8 accredited naturopathic medical schools in the United States, and there's one in Canada also. The other thing that you can do is ask that practitioner, are you licensed or registered? And then look up that license to verify, because unfortunately here in Colorado, we have a lot of lay naturopaths who understand traditional health and wellness principles but aren't doctors. And I've seen some dishonest marketing where they are, putting the logo of the American Association of Naturopathic Physicians on their website, or they're calling themselves a doctor. So, practitioners, and I believe if your heart's in the right place, you can be a health coach and help people. You can be a traditional naturopath and help people, but they have to be transparent. So number one, look at where they went to school. That's a first clue, and ask if they are licensed or registered and see if you can confirm that. When it comes to functional medicine, it's a little bit different because, again, it's not a profession, it's an approach. There are some organizations and institutions where a person can complete training through online modules or in-person workshops to gain that information, and those various institutions will have a list of certified practitioners. But you also want to find out if you're able to do a discovery call with that practitioner find out, what made them interested in functional medicine. Make sure their heart's in the right place. And number two, find out what their experience is, because unfortunately, one of the things we've seen is that there are a lot of medical doctors who want to escape the rat race of insurance-based healthcare. And so they go into functional medicine as a way out. But a lot of these practitioners are still doing full-time work in the ER or in a hospital. And their functional practice is like their side hustle. And it's not what they eat, sleep, and breathe. And so it's more of something they dabble in than something they own. And, everyone has to get experience under their belt. I'm not here to bash anyone, but I think it's important to find out how long have they been doing this? What brought them to it? Just get a feel for it, but be very careful of naturopathic practitioners and make sure that you're working with someone who actually has, a full medical scope of training. And again, I have met some very smart lay naturopaths who are helping people, but they have a duty to be transparent about their training and what they can and cannot do for you.
Yes, that was very well said.
Thank you.
Thank you. Thank you so much, because we see it so often, and we have these scammers coming in our support group, trying to solicit people as well. It's very, very sad, but and I'm anxious for you to share that link afterwards as well.
Absolutely.
Put that up as a resource. Awesome. So that's going to bring me to, since we're touching on passion, what did bring you guys to the HS realm?
Yes.
In your passion.
Yes. So Dr. Egeland and I went to school together, naturopathic school. That's where we met. And about halfway through our training, we were studying dermatology. And I remember one day I was in the library at school looking through a medical textbook, and I stumbled upon HS, and I had never heard of it before. I was very intrigued, and I started reading about what it was, and most importantly, how is it treated? And what really stood out to me is that the treatment options, as were laid out in this textbook, were basically lifelong antibiotics or extreme surgery. And I was like, what? Now, that blew my mind, because already as a naturopathic student, and for those of you watching who haven't read my bio on our website, I used to suffer from bad acne, and I was treated for that acne with antibiotics, and then everything got worse. And so I already knew that antibiotics can make any kind of skin problem worse. So I was just horrified, and I thought there's so much more we could be doing with this. And then in an act of synchronicity, I read on a health blog, someone shared a testimony about how a paleo diet had put their HS into remission. And that intrigued me. And I was like, I've got to figure this out. So I decided to do a grand rounds presentation for my senior project on HS, because I wanted my fellow student interns who were going to be practicing in the real world to see it, identify it, understand it. And my heart was so touched. The more I learned about it, and the more I heard people's stories about the pain they lived with, and the shame that was thrown upon them. This is your fault. You're overweight, or you don't have good hygiene. It really tore at my heart. And I went into, and Dr. Egeland too, we went into naturopathic medical school because we both had our own health struggles, and we both wanted to be of service to the people who had really fallen through the cracks. And I thought, what better group of people to serve that something so painful. There's such limited conventional options. We can do so much more. So after that grand rounds presentation, and it was open to the whole campus, so many people came up to me afterwards and either acknowledged that they had been secretly living with HS, or their brother. Like, I was just amazed at how many people this condition has impacted. So that was just further validation. So then when Dr. Egeland and I decided to practice together after graduation, that was always at the forefront. Like, we're going to be of service to people with HS.
Thank you. Thank you for doing that for us and thinking of us. Because we need other. I'm sorry.
I was just going to piggyback on that and just say another reason we're so passionate too. it's literally the worst quality of life disease that we have seen in patients. And I've had several HS patients, they had gotten to the point where they wanted to take their own lives because of the pain and the suffering. And just, my heart breaks when I hear that. And we want to help everybody that wants our help. And I think that's another reason we're so passionate about it. There doesn't seem to be a lot of good help out there, and just knowing how poor the quality of life is and how painful it is, helping someone in that situation is the most rewarding thing you can imagine. So
I can imagine. And I know that feeling. And I know, Dr. Egeland, you do a lot of research. I know you're heavy in the research, and I'm sure you've seen a lot of research done on HS and how high the suicide rates are for this illness. And it's really, really sad.
yeah, heartbreaking.
Really sad. So I understand. And again, thank you. And I know that this type of path is unfortunately is not covered under insurance yet. I say yet because I believe in my heart someday it's going to get there, especially if we can get modern medicine to start working closer with the functional medicine concept and work together with doctors like yourself. I believe someday. But what do you do for people like us who cannot afford this type of service? Do you offer payment plans? How do you maneuver that with people like us?
Yeah. We do offer payment plans. And also, this is what I really want people to recognize, there is so much that you can do on your own to manage and understand this condition. I got a really sweet phone call from a gentleman that watched our YouTube videos a couple of years ago, and he just kind of wanted to vent, but also say thanks, because he was like, I could have been doing this, this, and this. My doctor never told me. And so we're just really moved by the positive feedback and messages we get when people say, oh my gosh, I did what you said, and I haven't had a flare in 2 weeks. And there's a lot that we can do. And, sometimes it does take a little bit of an investment. It might not have to be working with us one-on-one, but even something like drinking, getting a water purifier to reduce the chemicals going into your body, or making some subtle diet changes. That's really important. And honestly, I think the most important treatment is hope. I say that because as soon as we've made up in our minds that this will never get better, nothing can be done, I really believe energetically that puts a damper in the healing process. And so if nothing else, I think that's why we want to put our work and our message out there to let people know there's so many things that we can do. We believe everything is figure outable, not to be deceptive or mislead anyone, but that's the kind of bigger thinking I think we need to have if we're going to conquer this, going forward in faith that something will work, something will be figured out. We can do this.
I also think that's why we created the Help for HS website, just to provide a lot of really helpful tools and resources. And a lot of the information and videos on there are talking about things that we do with our patients that we work with one-on-one. And then Ashley and I are working on some other ways to reach and help more people. So, if you're interested in being on our list, we're going to keep sending out information as that unfolds. So we're trying to find more ways to help more people.
That sounds exciting. And yes, I 100% agree with HS Connect's all about bringing the positivity and hope, and, giving them, don't lose hope, no matter what it is, because once you start wiring your brain on that negative thinking, it's just not healthy for you, period. I can flare just if I start thinking negatively and bring that stress upon myself. I know exactly how that can impact, at least myself anyway, for my personal HS. So
absolutely,
you can't put a price on some things, and hope is one you can't put a price on.
Yes, absolutely.
This is another one HS Connect is very, very passionate about. And I definitely want your opinion on this. We are anti-antibiotic for HS, and it's hard for us because we're patient advocates first. Okay. We work with the medical community, we work with researchers, but the patients and warriors are always first. So we've got the medical community who we work with who are constantly prescribing antibiotics when they don't have infection. And we know they're doing this for anti-inflammatory purposes mainly. No. We disagree, and we will always advocate against. Please, can you help us explain to the community why antibiotics are not a feasible choice for HS? If you agree, if you don't.
I 100% agree. And I'm so glad you bring this up, because I really think over time, the chronic antibiotic use makes the disease worse. I really thoroughly believe that. Obviously, there's a time and a place for antibiotics. They can be life-saving, but as far as the fix for HS, it's just not the case. Anytime we take an antibiotic, I know you mentioned there are anti-inflammatory properties, so they might provide a short-term benefit, but you probably have heard the term microbiome. It's that collection of microbes, which includes bacteria, yeast, viruses, and other microorganisms in our gut, on our skin, throughout the entire body. And those antibiotics really disrupt that important ecosystem that is so vital for our immune system and many functions in the body. And that repeated antibiotic use, it really is so detrimental to that ecosystem. It creates a situation where we kill the good bacteria along with the bad. And then when you don't have good bacteria to suppress more pathogenic or opportunistic species like yeast, candida being the most common form of yeast, then you get a huge overgrowth of yeast. And that produces a number of toxins that really stress the body and the liver. We know that candida specifically and other fungus, so the fungus family includes yeast, mold, and mushrooms, but things in the fungal family are potent drivers of an immune response called interleukin 17. So I don't want to get too into the nitty gritty, but that's an inflammatory marker that is really linked with the disease process of HS. I've even seen some of the research studies call HS a Th17 driven disease. And again, we know that yeast and fungus really drives that Th17 response. So, that's one piece of it. Another link that we see with HS, which is also linked with Crohn's disease, and we've talked about this in some of our videos, is the antibodies to yeast called Saccharomyces cerevisiae. And so that antibody test is called ASCA, anti-Saccharomyces cerevisiae antibody test. And, we believe that fungal overgrowth kind of alerts the immune system, and then your immune system is just doing its job. It's trying to get rid of that yeast, but that creates a lot of other problems and inflammation. So there are a lot of downsides to the chronic use of antibiotics. And, hands down, in all of the patients that we work with, usually the ones that struggle the most are the ones that have had chronic long-term use of antibiotics. And it really has a lot of damages in the body. Another thing too is, we see a lot of fatigue with HS, and I'm sure there are multiple reasons for that. But antibiotics also damage the intracellular mitochondria that produce our energy. So that's just one more piece of that whole puzzle. So I'm sure there are other factors, but those are the ones that are top of mind. I don't know, Ashley, did you have some other?
Yeah, I think you covered it. The biggest thing, and again, this is so personal for me because I was given 3 months of doxycycline as a treatment for acne in my late teens, and it wrecked my body. That's literally why I became a naturopathic doctor, because those antibiotics made me so sick. I had no healthy gut flora. I was full of yeast. My skin got worse than ever. And all of my lab testing was normal because they don't look for fungal problems in conventional medicine for the most part, unless it's an extreme, exception. But I was just so inspired and just shocked at once I connected the dots and figured out what made me sick, I was like, you know what, never again. It's a temporary Band-Aid. And I think it makes people sicker in the long run.
Very temporary. I have fallen victim years ago. I'm 50-year-old now. Have had HS for almost 43 years. But when I was young, especially when they really didn't know a lot about HS, I allowed them to prescribe me various different antibiotics, right? I can't tell you what that's done to me, to include me becoming resistant. Well, I know you can't become resistant to an antibiotic, but the resistance that happens within your body.
Sure.
I am now very prone to cellulitis and sepsis and have gone septic shock several times. The problem is I'm very limited on what antibiotics work for me now.
Sure.
And that is the most common thing we see within thousands of people in the community. And it is because of the epidemic,
Yes.
antibiotic epidemic, one we're trying to not be participating in with, right?
Yeah.
And also we see it time and time again where antibiotics aren't working anymore, but they just prescribe others. It's got to stop. And we see when they're either continue to stay on them or come off them, what does HS do? Comes back with a vengeance.
Yes.
And we are working so hard to get doctors to stop prescribing these. And then some doctors will prescribe them for 3 months. Why? What's the sense? Why
Right.
even bother? So very passionate about this. And thank you very much for saying your piece on that. And we will continue to advocate against as well.
Yes, I love that. And, you know, I want to mention one of the reasons we're so grateful to be naturopathic doctors. And again, I have so many friends who are medical doctors. My father was a medical doctor. I respect what they do, but unfortunately they have limited tools. And so they're well-meaning, they want to help you, but they're working within a system and within a system of their training where, you know, they learn drug therapy and surgeries, and they're not taught to understand the interconnectedness of the body or, you know, how to support and facilitate the natural healing process. So in our practice, we use a lot of botanicals that can have antimicrobial actions, but because it's the whole plant and it works synergistically with our bodies, you know, there's a much less reduced risk of having resistance. And as a benefit, these botanicals have anti-inflammatory and immune supporting properties because they work with our body. They're not an isolated drug compound.
100%.
Yeah.
100%. Well, we'll see. We will keep fighting that battle.
Keep it up.
Let's get on to a couple of community questions because I at least want to cover a couple of those. Let's see. One community member asks, what are the most successful vitamins and supplements and how should they be taken? So I guess we can reword that. Do you have any suggestions?
Yes. Well, we're big fans of turmeric. That is a very anti-inflammatory root kind of compound, or I should say root plant. There's a lot of anti-inflammatory compounds in that plant. It also has antifungal benefits. So again, a lot of people with HS, either knowingly or unknowingly, have challenges with yeast and fungus in the body, and that can turmeric and curcumin compounds can really help to reset the balance of the gut microbiome. So that's a great one. Just taking a few steps back, we want to emphasize that the best supplements are the ones that are high quality. That's really important. And I know we've talked about this before, but not many people realize that supplements are not regulated by the FDA. And so it's truly like Scout's honor with the manufacturer, whether or not what's on the label is actually what's in the bottle. So I'll make a bold claim and say that most of the products, you know, at the health food stores, at the big box stores, and on online retailers are not good quality. And you have to be very careful buying supplements on Amazon because there's a lot of knockoffs where the pills in the bottle are not the actual brand. So just be mindful of that. And if something is very cheap, I know that we all want to be thrifty and maintain our budgets, but be very careful with what you put in your body. You are the most valuable asset you have. So it's not worth buying supplements, you know, at the dollar store when we have no idea if they're contaminated with wheat starch or heavy metals or a fat. I've seen studies where supplements have had over 100 times more like selenium than what's on the label, and that can be toxic. So quality really does matter. And then the other thing I say with supplements is give them time, because again, in the conventional model, which most of us are used to, you have a headache and you take the ibuprofen, it's gone in 15 minutes, or you take a drug and then the problem goes away fast. Supplements can work quickly, but they're meant to rebuild balance and support the natural function over time. And so they're not always an overnight fix. And you just have to trust that these small, subtle cellular shifts are happening, even if you can't perceive them just yet. So patience is important. But on our website, we have several different supplements that we feel are very targeted for supporting the health of people with HS. They're focused on gut health. They're focused on supporting a healthy inflammatory balance. Really important to cover the nutritional foundations, all of the minerals, things like vitamin D. So we are happy that we've been able to take some of the formulas that were previously only in our clinic and make them more available, because they're pharmaceutical grade. They are tested for purity, potency, efficacy. It's not, the random stuff from the health food store.
That's what I was going to ask you. Aside from what's on your website, and we have a dietitian, nutritionist on our team at who of you have met, Jillian, who is the same way, very, very strict, pharmaceutical grade only. But how does one know, aside from, oh, this is too cheap or whatnot? How would one know if they did not go to Jillian's site, to your site, that they're getting, is there something they can look for specifically? Is there a link that you could share with us?
Sure.
I mean, of course, we can send them your resources, Jillian resources, but let's say they're not comfortable with that.
Absolutely.
Is there another resource?
Yes. So one thing I would consider looking for on the bottle, you can look for a seal that says GMP, and that stands for Good Manufacturing Practice. And that's a certification standard that manufacturers have to go through to prove that they have high quality manufacturing standards. I think at a minimum, just don't buy stuff from the dollar store or Amazon. I mean, the warehouse is not temperature controlled or humidity controlled. It's been found that at least 30% of everything on Amazon is a knockoff. So that at a minimum.
I have a quick story to tell on supplements. This happened about 4 years ago. Again, I'm always trying different things, so I'm not on prescriptions all the time. Well, anyway, I ended up in the ER, very, very sick. And come to find out, one of the supplements that I have purchased off Amazon, it was blueberry. There are blueberry supplements. And I was trying to get my inflammation markers down. Anyway, long story short, I became very ill. And they were asking me what I was on. They always want to know supplements as well. The mercury ended up having mercury in it. High concentrated mercury.
Oh my gosh.
That's what was making me ill.
Wow.
So that just proves I stopped getting it from anything from Amazon after that. And that just goes to prove, first of all, why was there mercury in pure blueberry pills?
I know.
And that's how I learned my lesson the hard way.
Yes. Oh my God. I'm really sorry that happened.
Yeah.
I mean, it happens. There were lawsuits against, I think it was Walmart, GNC, and Target, because they had products on their shelves that were found to be contaminated with dried house plants, wheat starch, even though the bottle said gluten-free, and all kinds of other things. And so truly, I tell, if you're watching right now, there is no quality control with supplements. Anything goes. They don't regulate it. So you have to, do the best you can. And I love that you brought up our products. Like, we never want anyone to feel pressure to buy from us. We make them available solely to make it easy if you wanted to try something that's trusted and proven. But again, at least looking for something that has the good manufacturing or the GMP seal. And I am aware of a handful of, off the shelf brands that are high quality, because we've vetted them and we're familiar with their manufacturing practices.
No, I appreciate that, because I would say on average twice a day, the subject comes up in our support group.
Yeah, I know.
And recommendations from other members, Dollar Tree.
Yeah. Oh.
Yeah. So what really, and I try to chime in every time I get please do your research, only reputable resources. And this is really going to help. I hope people get this far in the recording. And if not, we may just do
Yeah,
an article on it. And we
I
are
would
doing
love
a
to.
supplement article
Yeah,
as
I
we
love that.
discuss.
Yep.
So,
And that's another thing too, because if people try supplements that are really low quality or they make them sick, then that plants the seed in their mind that this stuff doesn't work.
exactly.
Kind of like if they go to an unqualified lay naturopath who doesn't know what they're doing, they're like, oh, natural medicine doesn't work. And it's like, well,
Exactly.
you got to, do
Well,
some.
guys, if you're watching this far, we are working on a supplement article with these two doctors and our dietitian that will be released soon, as soon as we get to it.
Absolutely.
So just looking at the time here, we're already 40 minutes in. So I want to give you guys an opportunity. We have many more questions, everyone. So we're going to do a part 2, but I want to give you guys the opportunity to take a few minutes if you want to discuss anything about your clinic, how people can reach you. Obviously, we have you listed on our website as a resource, but how that looks for somebody contacting you, whether it be a one-on-one. Do you offer webinars? Do you ever offer any free webinars? Anything like that?
Yeah, sure. So we do offer one-on-one care. We're doing telehealth, a lot of it now. So that's wonderful. In terms of webinars, honestly, our YouTube channel is something that we are really wanting to get back into. We had a lot of work going on over the past year, so we haven't been doing as many videos, but I have a stack of articles this thick with the newest HS research, and I have so many. We've talked about how we have a horse trough of ideas, so there's just so much that we want to share, and we're going to be doing more YouTube videos that will, be on our channel for free. But here's what I want people to know. Number one, if you feel inspired or felt like you would ever want to work with us, we are so transparent in how we think we can help you. And we always start with a discovery call. We always want to make sure that it feels comfortable and like it's a good fit. There's never any pressure. And so this is not something that would ever be, forced on someone if they want to have a quick chat. It always has to feel like a great fit. And if for any reason we feel like we are not the best fit for you, we will let you know and refer you to a colleague or some other place that we think would be a perfect fit. So that's how we always do things is, coming from a place of love, coming from a place of wanting to be of service.
That's amazing. I can tell you just from HS Connect side, we saw something in you in the beginning, which is why we reached out to you, and we are beyond honored to align with you guys.
Well, the feeling is so mutual, and we have so much love and respect for the HS community, which is why you won't find us, intruding on support boards or, trying to pitch ourselves here and there. So it means a lot that you reached out to connect with us. And we're just so grateful and happy to have befriended you wonderful ladies,
Yes.
HS Connect. It means a lot.
We definitely feel the same. So is there anything else you want to go over? Like I said, we'll have a part 2 so we can hit up the community questions because they're going to be anxious about that.
Yes.
But I feel that we definitely got the word out about who you guys are. And I'm excited that we covered supplements, and I'm excited that we covered what to look for, how we can find somebody reputable. That was really, really big for me. And we will build up, how people can get in touch with you guys who want the one-on-one help. I think that you guys are going to be very valuable within the HS realm.
Yeah. Well, I think in the meantime, Dr. E and I would just encourage people to join our Help for HS newsletter. And I know that we'll share a link. We send a lot of emails walking people through, as Dr. Egeland mentioned, the same methodologies that we use here in our practice. And a lot of it's not as fancy as you might think. Some of the simple things that you can start doing now can really help to move the needle. And I think one of the final thoughts I want to leave people with is that there are so many options. You don't have to be feeling hopeless. You don't have to be confined to the conventional limits of antibiotics or surgery. But the most important thing is to take that first step in faith. You don't have to see all of the how, but if you strongly desire to see changes in your life, if you really believe that it's possible, just know that you are so worthy, you're so loved, you're so deserving. And there is hope, but you have to believe it and take that first step in faith.
Yes. Yes. Very, very well said. And I love that people have an option, a place to go where they're treated as individuals and not like cattle.
Very
And
much.
I say it that way because with regular medicine, they kind of try to treat HS as everybody, you treat you the same. You can't do that with HS.
No, you cannot.
And most illnesses, not just HS. It's very individual. It's we all have different triggers. We act different. Everything's different, and that's why I like things like this, because you look at an individual and their illnesses is very personal, and it's so important.
Absolutely.
So important. Well, all your information will be down in the description below, so everybody can find you. They can also find you on hsconnect.org. And I am so excited to do a couple more interviews with you guys. It's going to be very, very
Talk
good.
about.
We're
Yeah.
honored.
Oh, there's always stuff to talk about.
Yeah.